It is estimated 1 in 10 people will experience a seizure in their lifetime, but they don't always look how they're commonly portrayed in movies and TV shows, with someone falling to the ground in violent convulsions. Recognizing the more subtle symptoms of seizures is key to diagnosing epilepsy and receiving effective treatment, and a new national survey shows most Americans are unaware of these lesser-known symptoms. It's all in this week's Health Smart.
Can you keep your hand up for me?
When the hair on Mike Sale's arms stand up,
it's even going to the other arm.
That's how he knows he's having a seizure, as well as
My flushing feeling that goes up, starts in the abdomen, works up into my head and into my right ear, and then sometimes I get a little lightheaded and dizzy.
Touch my finger.
Dr. Dipali Nemade is an epileptologist at Orlando Health and says seizures can show up in dozens of ways. A national survey by Orlando Health finds most people recognize seizure symptoms portrayed in movies, such as convulsing or losing motor function. However, less than half recognize signs like blinking rapidly, becoming stiff, and crying out as symptoms. Only 6% recognized laughing.
Some seizure where they have awareness, they know something is wrong with them, but they don't feel a need to go to doctor. Because it's not affecting their quality of life to that extent, or they don't know how to explain it.
Dr. Nemade says that's why educating the public about seizure symptoms and being able to recognize them is so important.
We need to do a better job at creating awareness about the epilepsy and preventing deaths because of epilepsy, because these are the cases we can help and we can, save somebody's life.
Sale suffered seizures for 6 years before his diagnosis. Now he says he has some relief.
My life has been much better because the frequency and intensity of the seizures have diminished greatly. That's it, sequence, I win.
Dr. Nemade says treatment is hyper-personalized for each patient, and in most cases, medication paired with adequate sleep and lifestyle changes can keep seizures at bay. If you have unexplained symptoms you think may be related to seizures, experts say talk to your doctor or see a neurologist.